السلام عليكم ورحمة الله وبركاته. معكم دكتورة رهف جذبة من سوريا، خريجة جامعة حلب عام 1997. حصلت على ماجستير ليزر ان دنتستري من جامعة آخن في ألمانيا. Today we will talk about laser and how laser it can improve our treatment and stimulate healing in many applications. How does the use of laser improve the outcomes of dental treatment? Laser in dentistry, an innovative tool in modern dental practice. Lasers are indicated for a wide variety of procedures in dental practice. Use of the laser proves to be an effective tool to increase efficiency, specificity, and comfort of the dental treatment. It has 3D benefits: selectivity, bacterial reduction, and biostimulation effects. We will discuss now many cases and many applications. We use laser in dental treatment, and we will see how the laser it will make our work selective, and how we will achieve the bacterial reduction, and how we will stimulate healing. The use of laser in dental treatment for pregnant women and children is safe. And more than that, it is an essential tool for diabetics, cardiac, and high blood pressure patients, because its procedures most of the time doesn't need anesthesia and leads to bacterial reduction, which is a very important issue for these patients. In 1997, an erbium yak laser was cleared for marketing by FDA. Now we will have an idea about laser wavelengths on the electromagnetic spectrum. We have invisible light, we have visible, and we have infrared parts. We will talk about these three parts in this electromagnetic spectrum. Source light according to their frequency or wavelength. We have ultraviolet light, like excimer laser in ophthalmology. Visible light. This part important for us as a dentist. It's from 400 nanometer up to 700 nanometer. Here we have many wavelengths. Most of them we use it for low-level laser therapy. At 700 nanometer turns into infrared. The human eye can normally see wavelengths up to 780 nanometer as a red light. The electromagnetic parameters are detected by our eye retina and converted into color information by our brain. Now we will reach to this infrared part. Infrared part, we have near infrared, and we have mid-infrared, and we have far infrared. Near infrared we have 810 nanometer, 880 nanometer, and 940 nanometer. All these wavelengths are diodes. We use them a lot in dental treatment. All of them, they are absorbed in melanin and hemoglobin and transmitted in water. Except 980, it has a peak power of absorption in water. That's why we have to take care when we use it in periodontal pockets. We have in this part also Nd:YAG laser. We have two wavelengths. The most common one for us, 1064 nanometer. It is a surgical tool, good coagulation, and it is efficient in pigmented bacterial reduction. Mid-infrared, we have holmium yak laser, and we have erbium yak family. Erbium yak family, we have erbium yak 2940 nanometer. is highly absorbed in water and OH molecules, so we use it for hard tissue, bone, gastric, enamel, dentine, and caries lesion. And second one, we have erbium chromium YSGG. Its wavelength 2790 nanometer. Also, it is highly absorbed in water and OH molecules, so we use it for hard tissue, bone, cartilage, enamel, dentine, and caries lesion. Changing the pulse duration will means show the laser concentrate in its energy in time. It will become suitable for soft tissue surgery. Just I want to mention one thing here. We have to know that erbium chromium YSGG has absorption in water, but it is less than that erbium yak has it. That's why when we will use erbium chromium YSGG for hard tissue preparation, we have to use more water. And we use water with erbium family, not for cooling. We use it to create the ablation. For infrared, we have CO2 laser. We use it for surgery. We will just repeat a summary. Here, ultraviolet, visible light from 400 up to 700. Here, many wavelengths. We use it for low-level laser therapy. Here we have infrared. We have near infrared, diode and Nd:YAG, and then we have mid-infrared. We have helium yak and erbium chromium and erbium yak, and then far infrared we have CO2 and we use it for surgery. Now we will talk about optical properties. We have to understand this term well, because if we know it, we can understand how the tissue interaction will take place and when and how we have to use the specific wavelengths for specific tissue. Optical properties define the biophysical interaction of the specific wavelengths with the tissue. The more optical properties we have in the tissue, the higher absorption of the specific wavelengths will take place. The optical properties for erbium chromium YSGG and erbium yak are water and hydroxyapatite. And for diode, they are hemoglobin and melanin. Optical properties is by volume, not weight. So how much energy can be absorbed per time in a certain volume by a specific wavelength. Now we will discuss some cases about dental treatment and how the laser can improve the outcome of this dental treatment. We will start now talking about laser cavity preparation. How laser can make our preparation selective. So, selective removal of caries. We mentioned before, the interaction between laser and tissue is strongly dependent on the optical properties of the tissue. Enamel is highly mineral tissue, composed of 85% mineral, 12% water, and 3% organic material by volume. On the other side, dentine has a significant higher content of organic material, which is 33%, and water 20%, and only 47% of mineral tissue by volume. The occurrence of caries directly affects the mineral and water tissue content. As mineral is lost, its volume is replaced by water. In caries affected dentine, the water content is an average of 27% by volume, but it can reach up to 54% depending on the disease stage. Here we can understand that if we have caries dentine, that means we have more water content. And if we have more water content, we will have good ablation by using erbium or erbium chromium. we summarize this and say, so we have to adjust our setting due to the water content in the dental hard tissue. More water content means we need to decrease the power and increase the pulse duration, which leads to less peak power, and caries lesion will be removed nicely. Up to the above, we can remove the caries tissue selectively. I want to add something here. If we have deep caries near to the pulp, we change the setting and reduce the power, and by this way I cannot remove solid tissue. I cannot remove solid dentin. I just can remove the caries dentin. That's why it will be selective. On the other hand, there is loss of structure up to 500 micrometer depth by using high-speed handpiece because of mechanical vibration, pressure, irritation, etc. Thus, the structure of enamel and dentin is lost, and due to the previous causes, we got loss of hardness up to 80%. Now we will talk about the second factor, which is bacteria reduction. Studies show that there is bactericidal effect up to 500 micrometer below the cavity surface. The use of a drill will produce dentinal debris which cover the dentinal tubules and close them. This will keep the bacteria inside the dentinal tubules and they can migrate deeply towards the pulp. But on the other hand, by using laser to prepare the cavity, we can do another step of sterilization in the deep cavity by applying low setting to dissociate the water molecules. And we know that the molecule O is very toxic to the bacteria, and as a result we can prevent new caries. Here we have two benefits. Erbium can remove all debris and open the dental tubules, and by thermal effect can reach the bacteria inside dental tubules and kill it. And also if we apply this another step by using low setting, we can also do another step of sterilization for the cavity. Now we reach to the third factor, biostimulation. Laser can stimulate odontoplasts to produce tertiary dentin. Alkaline phosphate enzyme, which is responsible for bone growth and regeneration. In the case of an accidental pulp exposure during laser cavity preparation, we use low setting and lace the pulp. So the first 3 to 4 micrometer of the pulp will be slightly heated. This very thin layer will be dehydrated, and this process will stimulate the odontoplast to produce the tertiary dentin. Studies show that the formation of preparative dentin hastened by erbium yak is at a faster rate than the pulp exposed by burr preparation. Time of repair is much more faster. Also, I will add here another point. If we do laser cavity preparation and we expose the pulp, here our exposure, it will be exactly clean, no bacteria, no caries. So this is other reason for good and better healing. Laser cavity preparation is not only safe for the pulp, but also induces better repair reaction. The formation of reparative dentin after cavity preparation was shown to be more frequent in erbium yak laser irradiated samples than high-speed drills one. Now we can find also other advantages for laser cavity preparation. It is less pain. We use lower power near to the pulp because we have more water content. which is the main optical properties for erbium YAG and erbium chromium YSGG. This low setting causes 400 times less vibration than the use of burr in the traditional technique. That's why patients will not feel pain most of the time. Measurements with thermocouples during erbium YAG laser cavity preparation under water supply indicate temperature increases of less than 2 to 3 degrees centigrade, even when high energy density applied. Also, other benefits for laser preparation. We can reach a small caries area. We can reach it and clean it and finish it without doing cavity. We will see this case now. Old composite filling. We can remove whole composite by laser. And see here the caries dentin. We clean it. We have clean dentin and the sterile surface. And here the final filling. Other case now. Of course, if we are talking about laser, we have to use rubber dam, because our target to achieve bacterial reduction as much as we can. So it's very simple that we have to use rubber dam. We start to clean the caries from the enamel. You can notice here how we save the dental tissue and expose the caries area only, and we can remove it selectively. The final filling. I will show you here a video just to show you how the laser can remove the caries spots. By the way, this video from YouTube, you can find it on YouTube, but I choose it because it's really clear, so you can understand the topic. You can see here the red spot, how it can move and remove the caries tissue selectively. It's very important, selectively. We can keep the other clean tissue. No need to prepare wide cavity, because also our preparation, we mentioned before, bond etchant and etchant and bond steps by laser also give us more strong bond steps with the composite. It is clean. Studies showed that the use of etchant and laser bonding step will give us better results. We will talk now about laser pulp capping. We have old amalgam filling and deep caries cavity. Here we cannot use laser to remove amalgam. We can apply laser around amalgam, but on the dental tissue, so we can make a small cavity and then we can remove the amalgam. Or you can use high speed handpiece and remove the amalgam, and then you transfer to the laser to clean and remove caries. Here we have exposure. As we mentioned before, when we use laser, the area it will be really clean and sterile. We make laser pulp capping by using glow setting. You can see the results immediately. Finish the case, and case will be for follow-up. This case since 1 year and until now, no symptoms, and the pulp vitality test is still positive. Laser veneer removal. Erbium laser energy is transmitted through all ceramic materials. The bonding cement absorbs this transmitted energy selectively, so the ablation takes place, leading to the restoration within seconds. Here, really very interesting procedure. We can remove the veneer without breaking veneer, without touching or make any cracks on the enamel. Even here in this photo, you can see the cement is still on the surface of the teeth. Sometimes we have mistake to do cementation for one veneer and we have to remove it. Many times we cannot remove it and we need to cut it. But with laser we can remove it easily. No anesthesia, no pain. For me, for one jaw, 10 pieces, I need maybe 5 to 7 minutes to remove all veneers. Dentin hypersensitivity. The application of laser to decrease dentin hypersensitivity have been investigated for the last 15 years. Erbium YAG and erbium chromium ECG can effectively decrease the dentin hypersensitivity, resulting in long-term effects not commonly observed with conventional treatment. But ND-YAG laser showed better results in pain reduction than the other laser. Also, I want to mention for one point, also we can use diode for this goal. We can use it for laser dentin hypersensitivity, but erbium chromium ECG is more effective than diode. Sometimes we make sharing between diode and erbium. Most of the time, for me, I use erbium chromium ECG. Laser created more retentive surface before veneer cementation. Here we have this tooth. You can see the difference between this part and this part. Here we use the bond prep step by laser and etchant. Here only we use the etchant. You can see the difference. As I mentioned before, studies show that the cementation or the bond strength, it will be better by using the bond step prep by laser. But we have to use also etchant to get this better strength, bond strength. Caries removal and composite filling for 11 years patient. Here I use laser, erbium chromium ECG, no anesthesia, no pain. I just adjust the setting. In deep area we decrease the setting. Patient did not feel any pain, and finish the composite filling. All this case done in one visit. Now we reach to very important part. Laser assist root canal treatment. We know that the key to have high successful rate of root canal treatment is a good bacterial reduction in the whole root canal system. There are many protocols to achieve this target by using irrigation, medicaments, good shaping and cleaning, etc. But still there are morphological limitations in the root canal system itself. which we cannot reach them by conventional methods. We will discuss now this morphology and this limitation. First limitation, dentinal tubulus permeability for microorganisms. Dental tubulus permeability for microorganisms and the bacteria can immigrate inside these millions of dental tubulus, which they have opening holes of 5 to 8 micrometers, and all of us we know the bacteria size from 3 to 5. So imagine how much or how many bacteria can immigrate inside these dental tubulus, and we cannot reach it by conventional methods of irrigation. Other limitation, second one, small root canal diameter. Small root canal diameter mainly in the upper molars, mesial and distal canals, and for the lower molar also for the mesial canal, buccal and lingual. Sometimes if we have very thin and very curved canal, we cannot do more enlargement because we will destroy the root or the apex. That's why maybe we cannot remove all infected tissue in the apical part. Extremely curved canals, also additional lateral canals. Here we can see that sometimes we cannot reach the bacteria inside these additional lateral canals. We cannot reach it by our irrigation solution. Also we have isthmus, this area which is between canals in molars and first premolars in the upper jaw, full of bacteria here. Sometimes, most of the time, we cannot kill all bacteria in this area, so we need something else to reach this bacteria and achieve bacterial reduction in a good way to achieve our target. Classical root canal therapy, mechanical chemical enlargement, bacterial reduction up to maximum 100 micrometer depth. This is a study done by 1993, which is not enough because minimum classical bacteria migration is up to 1100. So here we have to understand well. Bacteria migration inside dental tubulus, it will be up to 1100. Our methods, the chemical and mechanical enlargement, we can achieve bacterial reduction only up to maximum 100 micrometer. Still we have 1000 micrometer. We cannot reach it by the conventional method. The larger the diameter, the further the migration of bacteria to the periodontal ligament. Mechanical and ultrasonic enlargement only for the main canal. We have no access to the lateral accessories canal. This is other things that ultrasonic, irrigation, etc. we can do bacterial reduction in the main root canal. But what about lateral accessories canal? We cannot reach it. Root canal are not round tube. In reality, root canal system, it might have funny morphological structure. Even with enlarging the root canal up to ISO 70, many parts are left behind with highly infected materials. We don't like to do more and more enlargement. We will destroy the shape and the morphological shape of the root. We need to look for another way to have bacterial reduction and keep the tooth safe. Here we will have a look about this study. They make a study for bacterial reduction in the root canal, in the main root canal. They use many kinds of lasers, Nd:YAG, Helm-YAG, CO2 laser, diode laser, and erbium YAG. They found that if you see here most of them, almost all of them, we reach up to more than 98% bacterial reduction in the main canal. But take a look about this control group where we use hypochlorite, we reach up to 6.8 only. This is in the main root canal. The place that we can reach only by hypochlorite, here we can reach it by hypochlorite, but even that we achieve only 6.8% bacterial reduction. But when we use any one of these lasers, Nd:YAG, CO2, diode, erbium, we reach up to 98, 99% bacterial reduction. We will study this also in the root canal wall dentin, which is very important part. They use Nd:YAG laser and they study the bacterial reduction at 1000 micrometer depth. They found there is the bacterial reduction up to 85%. When they use diode laser, they achieve to 63.9%, but when they use erbium YAG, they study the bacterial reduction in depth 1000 micrometer, they found it 13.98. Look at this hypochlorite. They cannot study it in 1000 micrometer because this hypochlorite solution can reach up to maximum 100 micrometer. But we have a question here. Why these differences between laser? I mentioned before, each laser, it is special as is it. This wavelength, it's different from this wavelength. This wavelength diode is different from this one. Each one has specific biophysical interaction, has special optical properties in the tissue. Let us see one by one. Nd:YAG laser, we said it's highly absorbed in melanin and hemoglobin, and it highly transmitted in water. What the meaning of highly transmitted in water? That means it will go through the water without losing its energy. The photon will not lose any energy. That's why. I will see this photo here. When the laser Nd:YAG come here, irradiate the canal, the laser will go inside the dental tubulus, through the fluids inside the dental tubulus. It will not lose the energy, and all the energy, it will be absorbed in the pigmented bacteria inside this dental tubulus. That's why we have this result, 85% of bacterial reduction. When we will go to the diode, go back to the diode, we see here they use 810 nanometer. They found that we have 63.9 bacterial reduction. What the difference between diode and Nd:YAG? Diode also absorbed 810 absorbed in melanin, but less than Nd:YAG. And also it's highly transmitted in water, but also less than the Nd:YAG. That's why Nd:YAG can go through the dental tubulus more than the diode. That's why we achieve this bacterial reduction in dental tubulus more than diode. And if we take other diode, other wavelengths, 940 for example, we will have different reading, because as I mentioned, 940, it is a diode, but it has a special and specific biophysical interaction and degree of absorption and transmission through water or etc. Now we will go to erbium YAG. Erbium YAG, you see, here we have 13.9 bacterial reduction. Why? We mentioned before, erbium YAG, it's highly absorbed in water and hydroxyapatite. It's not transmitted in water. That means when we irradiate the main canal with erbium, this irradiation, this laser, it will go inside the dental tubulus. There are fluids, so it will be absorbed in this water. The energy, it will go here for ablation this water. This bacterial reduction 13.9, it is coming from the thermal effect of the ablation only. Because it's absorbed in water, erbium yak cannot go really very deep, because as he touched the water here, the ablation, it will be start here. Thermal effect, it will kill bacteria in this part. We cannot say this better than this. Each one has its effect, and if we make a sharing between two wavelengths to achieve one target, we can reach it. Just very important to understand the wavelengths, its biophysical interaction with the tissue, its advantage and disadvantage, and then we can decide. There is no bad laser. Each laser is good if we know how to use it and where. Smear layer blocks the penetration of irrigants, medicaments, and sealer into dental tubulus. So microleakage increased and bond strength of sealer and other resin-based dental materials. Erbium yak and erbium chromium YSGG can be successfully used to remove the smear layer, and the dental tubulus will be opened and diode laser can be transmitted inside them and kill the bacteria. What this means, if we go back again to our picture, here if I use erbium, I will remove all smear layer and open the dental tubulus, and it will be really clean. The main root canal, it's clean 99.98%. And I remove all smear layer and open the dental tubulus, and then I can use diode, for example, or Nd:YAG. I will take benefit from its transmission through water, and I will clean inside the dental tubulus. If I use Nd:YAG, I can reach up to 85%. If I use 940, I will reach up to more than 63%. Here I kill the bacteria. I achieve bacterial reduction in the complete root canal system. Laser was selective to remove the infected tissue and smear layer without extra enlargement to the root canal. It has great role in bacterial reduction for the root canal system and has significant effect to stimulate periapical lesion healing. There are many to talk about using laser for endo. Just I want to mention one point here. Sometimes if we have very big periapical lesion, we can lace the canal with diode, and this diode, it can be transmitted outside the apex and kill the bacteria in that area, outside the root. That's why we said here, has significant effect to stimulate periapical lesion healing. Here again, we achieve our targets. Laser was selective to remove the infected tissue and smear layer without extra enlargement of the root canal. It has great role in bacterial reduction for the root canal system and has significant effect to stimulate periapical lesion healing. Again, this happen again. We will see some cases from my own practice. Laser treatment for big periapical lesion. In this case, I use here diode 940. This is before and this is after. Here, the time between two photos, it is 10 months maximum. Also this one, you see the periapical lesion very big. I use also diode 940, and I can reach this one after almost 10 months. In this case, I use diode and erbium yak treatment later. Here, 2 months only the difference between this area. You see, I don't know if it is clear, the periapical lesion here, and also here no periapical lesion. During my treatment for this case, what I noticed that the wall of the root was weak. If I will just do enlargement, it will still comes out deprived, and it will make the root weak. But when I use laser, the erbium, I can remove all infected tissue in the main canal without making weakness or cause weakness to the root walls. This after 2 months. This case since maybe 2 years, and until now everything is okay. We will transfer now to talk about pulpectomy. It was observed that laser irradiation induced enhancement of calcification in wound surface and stimulated formation of calcified tissue. This observation indicates that laser irradiation is a useful method for the vital pulpectomy. Also, we have a lot to talk about laser in pedo. This is very important for me. That's why I just mentioned to it here in this lecture. Laser application for soft tissue. Laser soft tissue cuts provide bloodless, clear, and sterile working area. Remaining thermal effect reduce post-operative edema and stimulate good healing. At low doses, laser application stimulates proliferation, while at high doses it is suppressive. It affects fibroblast maturation and locomotion, and this in turn may contribute to the higher tensile strength reported for healed wound. In soft tissue we have a lot to talk about, but the use of laser really improve the healing, no pain, most of cases no anesthesia. I cannot discuss everything in this lecture because I don't have enough time. Just I want to mention to some procedure which I see it's really important in our practice, and all these cases from my own practice. Crown lengthening and laser root canal treatment. This case complicated. In this part I have many procedures. I did all these procedures by using laser, erbium, and dye. Here we notice that no space. Here we have an abscess, and you see this patient, I don't know here if it is clear, she has 2 implants here but no space to put the implant. We will see what will happen with this case. Here this is before. Here I use erbium to make crown lengthening for this lower part. I use it for the soft tissue and for the bone. I want to mention something before. These 2 premolars, I have the X-ray. It has big periapical lesion. Also I treated by laser, and I will show you the photo. But now we will continue photos of crown lengthening. This photo after 1 week. After I finish everything, I make gold post for these 2 premolars. After gold post cementation, we will see the photo of the endo for this case. Patient, when she came before, she wants to do extraction for this teeth. Very big periapical lesion. And as you see before, it's covered with soft tissue and abscess. This result after 3 months. Complete healing. Also, I did not damage the wall of the root I just remove the infected tissue selectively and achieve good bacterial reduction by using two kinds of laser diode and erbium. We can see the final result now. This is before and this is after. This area before and this is after. This case, I have complete treatment plan for hair. We did many things by laser. This case stay with me in the clinic for 10 months. We did many things, crown lengthening for some anteriors here, and I will show you the photos. Here also for the upper jaw, I did also crown lengthening, and I did endo. All my endo, I use laser to achieve good bacterial reduction, to have very high rate of success for root canal. This case, the same patient. Here I did recontouring by erbium for the anterior, and here this lateral and this lateral I use erbium for the bone also, so I can have this final smile. By the way, this photo at the same day of cementation. Still I have to take another one after 1 week or 2 weeks. This is crown lengthening also for this patient. This patient, she is adductor. Also she came to me with this, and also she has a big periapical lesion on this canine, and she is complaining from this look. Also here we did crown lengthening for bone and soft tissue for the centrals and for laterals, and we did good root canal treatment for the canines, and then we finish our case with this. Crown lengthening not important only for the Hollywood smile or whatever, yani. It's also important for some cases that we have in the clinic. This patient, she is 12 years old. She came to my clinic with this. She has pain here. She cannot bite and she did not eat on this side. When I remove the composite, I see this. You can see the margin of the tooth here. After I did good root canal treatment and I disinfect and clean the root canal system with 2 laser also and finish obturation, I did here crown lengthening for this part and here also. So now I have a clear and clean margin, so I can finish my empress filling easily. If you go back, you can see here the margin and here, and also I make exposure for the premolar here by laser. You can see. Also this at the same day of cementation, this photo. Surgical extraction, it's really amazing when you use laser. I use erbium to open the soft tissue. You can see here by erbium. I prefer here to use erbium to open this soft tissue. It is thick, and if you will use diode, I afraid if you will stay a little bit more, the thermal effect, it will go deeply in the deep layer and maybe it will make necrosis. Take care when you use diode. Very important to concentrate about the time and about your movement, how you will move the tip and the angle of the tip with the tissue. For this surgical extraction, I prefer erbium. It's more safe. Also by erbium I can remove the bone, and if I use laser to remove the bone, I have less edema and I have a clear area and clean, no bacteria and in the wound. so the healing it will be better. And what I use and what I did also here, after this I used low level laser therapy after I finish the extraction and the suturing, so patients you can leave without feeling pain. Even sometimes patients take medicine analgesic for 1 day. Low level laser treatment of gingival fibroblasts in the culture has been shown to induce transformation in myofibroblasts. Useful in wound contraction as early as 24 hours after laser treatment. When we use laser for surgical extraction, patient will not complain and will not have pain. After, you can see this case. We use diode 810. This is after 2 days only. But patient at the same second after I finish using laser, no pain. The positive effect of low-level laser therapy on the healing of lesion of recurrent abscesses, stomatitis in a human have also been recorded. Post-herpetic neuralgia and abscess ulcer, it has been demonstrated that photostimulation of abscesses, ulcers, and recurrent herpetic lesion with low level of laser energy by helium neon can provide pain relief and accelerate healing. In the case of recurrent herpes simplex labialis lesion, photostimulation during the permodal stage seems to arrest the lesion before painful vessels form, accelerate the overall healing time, and decrease the frequency of recurrence. Fibroma removal. This fibroma on the tongue, I remove it with erbium, no anesthesia, no pain. This is after removing immediately. This is the size of the fibroma. After I finish, I also use diode as a low-level laser therapy. At the end, I want to thank you for your time, for your good listening to me. I hope that I can give a very simple idea about laser and how it can improve our dental treatment outcome. And I hope I can give more and more in the future. If you have any question or any consultation, you can contact me. I will put my number and my email, and I will be happy and glad to help anyone who wants to know a lot about laser. It is really good and amazing tool in dentistry. Thank you very much.